Test yourself before you wreck yourself. A PSA.
So throwing this bow, chicka wow wow, what you gonna say? You act like you gon' leave, but I know that you gon' stay. Break it down, dick it down, girl, don't even play. Once I set the mood.
It does matter. STI rates in Minnesota are on the rise, especially syphilis. Syphilis is treatable, but there aren't usually any obvious symptoms. Syphilis is called the great imitator because the signs and symptoms of it mimic so many other diseases. Primary syphilis begins 1 to 12 weeks after exposure, with painless open sores around the mouth, genitals, or anus. The sores last 1 to 5 weeks before going away, but syphilis remains in your blood. Secondary syphilis occurs 6 weeks to 6 months later with a rash, flu-like symptoms, gray patches on the lips, wart-like genital lesions, and hair loss. Late-stage syphilis is in your blood and can affect your heart, brain, and other organs. If untreated, syphilis can be fatal. Syphilis occurs worldwide, primarily in urban areas. Cases are rising fastest in women, males who have sex with males, people aged 15 to 25, people who exchange sex for drugs or money, American Indians, and African Americans. Your risk increases if you have unprotected sex or don't use condoms correctly, have multiple sex partners, or have a partner who has syphilis. In 2018, Minnesota had 918 new cases of syphilis, mostly centered around the Twin Cities. You can check whether you have syphilis via a quick blood test at a clinic. The Minnesota Department of Health's website has a list of free or low-cost testing sites with varied hours to accommodate busy schedules. Syphilis is spread from person to person through direct contact with a syphilis sore. Transmission can occur during vaginal, anal, or oral sex. Pregnant people with syphilis can pass it to their baby. Barrier method usage reduces the risk of syphilis. This includes anal and oral sex barriers. The CDC has created a condom locator to find free or reduced price condoms near your location. Boynton Health Services also offers free or low-cost sexual health supplies. Healthcare providers should remember the phrase talk, test, treat. Talk to your patients. If they're sexually active, take a thorough history to determine if they are at a higher risk for syphilis. Test your patients. Test all males who have sex with males annually. Test pregnant people at the beginning of their pregnancy and again in the 3rd trimester. Other patients may need different schedules for syphilis testing based on their unique health needs. Treat anyone who tests positive for syphilis with long-acting IM penicillin G. Advise these patients to tell their sexual partners about their test results so the partners can be tested and treated as well. Report all cases of syphilis to the local or state health departments following your agency's protocol.
So throwing this bow.